Hi there, Grant Blaschke here from FamilyDoctor.expert, and today we're going to talk about the risks of unnecessary investigations. So it's easy to think, what's the harm in just having a few tests? Better to check something than not, but there are actually some downsides to over-investigating. So let's talk about 10 of them now. Number one, there's the risk of the actual mechanism of having the tests, bruising from blood tests, allergic reactions to the imaging dyes, and having too much radiation from x-rays. Secondly, there are false positives. That is when the test says that you have a disease when you don't. And if you have multiple tests, even if they're 95% accurate, if you have 20 of these tests, one of them is going to show something abnormal, and this can cause an enormous amount of stress. Thirdly, there's the risk of what we call artifacts. Our tests are becoming more sensitive and more powerful, and it means that sometimes we find irrelevant things. For example, on CT scans, we find cysts in the liver and all sorts of things that then need to be followed up. Fourth reason, it can be very hard to interpret ambiguous results. Take the example of the prostate-specific antigen, the PSA test. Even when it's positive, we're a little bit uncertain what that means for management, and it may mean people go on to have unnecessary tests and treatments. Fifthly, sometimes the tests aren't really going to affect the management. For uncomplicated back pain, x-rays of the back are often done, but are probably a waste of time. Six, the risk of over-monitoring. The thinking at the moment is, for example, with diabetes, type 2, people on oral medications, there's probably not a great need to be doing self-monitoring all the time. This is something you should talk about with your doctor. The seventh risk is what I'll call unscientific, untargeted screening. So for example, doing vitamin D tests on the whole populations, or a few years ago there was a trend to do whole body CTs on people that were well, has all sorts of risks. Eighthly, there's the expense, obviously to the individual, but also to the community. We've got a limited health budget. If we waste it on this unnecessary tests, we have less to spend. Ninth, it's a waste of time. If you go along and have an x-ray, you've got to go along to the imaging place, then you've got to go back to the doctor, get your results. It takes a lot of time. And the 10th reason is what I've called unscientific over-investigation. So sitting in general practice, we get a range of natural therapists and homeopaths who send patients in with a list of tests to have, often relating to allergies or obscure tests. And I think it's debatable whether these tests are helpful and whether or not they should be funded by the mainstream Medicare funding. So although it seems like having more tests is always a good thing, there are these 10 risks. So run these past your doctor when they suggest you go and have a test. As usual, this is just for information rather than for making a decision. Make sure that you discuss these issues with your doctor. I wish you well from FamilyDoctor.expert.